Let me invite, ladies and gentlemen, on stage, and please put your hands together for Miss Sinu Joseph, Menstrual Hygiene Educator, Counsellor and Managing Trustee of Mythri Speaks, Bengaluru. Namaste.
I have worked on the subject of menstruation across rural India for the last decade. And the one change that I have observed over the last 10 years is the pace with which the conversations on the subject has picked up. And that's wonderful. But I have also been seeing how in our urgency to bring attention to the subject, we have created more myths than what we tried to break. I have 5 minutes to share with you some of these myths and why it is creating a negative narrative and taking the discourse away from where the focus needs to be. Myth number 1. I'm sure many of you would have heard this number, that 88% menstruating women in India. You need me to? That's fine. Thank you. So I lost a bit of my 5 minutes there. Okay. So the first myth that I want to address is how there is this data out there that says 88% of menstruating women in India do not have access to sanitary napkins, and therefore they resort to using things like sand, ash, husk, and so on. This is a number that you will find if you just Google menstruation India. This is a number that every NGO, every activist will make as their opening remark. But what is surprising is that this is not even a published study. I spent a year trying to get hold of this paper, and when I couldn't, I reached out to international organizations like the Society for Menstrual Cycle Research, based in Boston. They put their researchers on the job. And what we found was that this number is only mentioned in an article in a leading newspaper in 2011, and since then, everyone has been borrowing it because it makes a statement. So what if it's not true? So what are the real numbers? If you look at the National Family Health Survey of 2015-16 done across India, you will see that across India already 57% women are using sanitary napkins. In urban areas, the number is as high as 77%. And even in rural areas, it is 49%. Myth number 2. 70% of Indian women are suffering from reproductive tract infections because they use menstrual cloth. In fact, some people, including celebrities, often make the statement that using menstrual cloth causes cervical cancer. There is no established evidence that relates the use of menstrual cloth to any sort of menstrual or reproductive infection. The London School of Hygiene and Tropical Medicine did a study looking at 14 articles on this subject, and they concluded that there is no correlation between a vaginal infection and menstrual hygiene management. So it doesn't matter what you use, it has nothing to do with the chances of getting a reproductive tract infection. Coming to cervical cancer. The worst that can happen with poor menstrual hygiene is a bacterial vaginal infection. And cervical cancer is caused by a virus. Basics. Myth number 3. For some reason, we take pride in stating that Indian women have poor menstrual health and are suffering, and we need to learn from women in developed nations that they need to guide the discourse and tell us what we have to do. I studied over 150 published research papers on this subject, which is available in the public, and any of you can look at it. Do you know the prevalence of menstrual disorders in any population of women in India is not more than 20 to 25%. It's higher in urban areas. If you go to rural and tribal areas, it's actually much lesser. But if you look at the numbers of women in developed countries, for example, in England, 52% women have heavy menstrual bleeding. That's basically every second woman you meet has a problem. They did a study of adolescents across Australia and found that 94% adolescent girls in Australia suffer from dysmenorrhea, which is period pain. And yet every conversation, every dialogue is about them helping us. India is not the country that needs help. We are the ones that can help because we might just be the only culture remaining which understands how to prevent menstrual disorders. And it's evident in the number of menstrual health that we see. And that brings me to the last myth that I want to talk about today. The cultural practices around menstruation in India are taboo, are superstition, are repressive, and they are meant to suppress women. We've all heard this. It is such a pity that we invest so much to prove something, but without even spending even half the time, we dismiss something as a taboo. I've spent the last 5 years simply studying the science behind the cultural practices on menstruation. And what I learned is that every one of them is rooted in India's indigenous sciences. Even to have a discussion on it, we need to know the basics of Ayurveda, of Chakra, of Tantra, of Agama Shastras, and so on. And without knowing any of it, so quickly we dismiss it as taboo. There is an interesting study done by an Ayurveda doctor, Dr. Pallavi Pai and her team, wherein 30 women were studied over a period of 6 menstrual cycles. And they were simply told to follow all these so-called taboos for a period of 6 months. They looked at their health before and after the study. I'll just give you 2 examples of what the results were. In the beginning, there were 28 out of 30 women who complained of period pain. By the end of 6 months, when they followed these cultural practices as per Ayurveda, that number came down to 2. Similarly, there were 21 women who said that they experienced mood swings, anger, irritability, and so on. At the end of 6 months, that number came down to 3. This is the area where work on menstruation needs to go. This is where research has to happen because we are among the few people who understand this subject holistically and know how to prevent menstrual disorders. I was introduced as a menstrual hygiene educator. I really want to clarify that menstrual hygiene is not even an issue. It is not even an issue because none of the menstrual disorders, dysmenorrhea, menorrhagia, amenorrhea, have anything to do with hygiene. If we want to talk about menstruation, the subject is menstrual health, not menstrual hygiene. But to get there, there are 2 very difficult things we all need to do. The first, we need to be willing to say that we were wrong, like I did. We were wrong about this subject, and we just spoke about things without verifying the data. And the second thing that we need to do is be willing to learn from the very women we think we ought to teach. Thank you.